It started with the Hep A outbreak. The mayor called me and we set up a campground for folks in 6 days. We thought we'd have 4 families. We had 30 and 56 kids over in 20th and B. We made it work, but really the emphasis was to get a larger facility like this, where we've got 350 people. That'll be safe, access to health care, mental health care, food, security, all the resources that people would need to try and make the transition from homelessness back into society, which is a tremendous challenge. We've got people working, going to City College. We've got people working at NASCO and Walmart. It's a tremendous opportunity for people to literally detox from the street, regain their humanity and their dignity, and start the process of recovery. Most of our population here is over 60 years old. The vast majority of folks over here are trapped in some form of mental illness. We have a couple women in their 80s that are not mentally ill, are not traditional homeless, are not drug addicts. They're just simply poor. They get SSI, they get their Social Security and Social Security benefits, and they're getting $600 or $700 a month. We all know you can't live in San Diego on that kind of money. So here we're stuck today with thousands of people literally on the streets simply because, in many cases, they're just poor. There's a young girl in her mid-20s over here, early 20s, is pregnant. She's out in the street. So we're going to make arrangements to get her in here ASAP, at least so we've got the child with access to medical care. So there's miracles that go on here every single day. But this misinformation that's passed on in the public, it's $36 a day to house somebody here, to keep them off the street, to get them healthy, keep them healthy, and access to opportunities. You can't board a dog or a cat for $36 a day. We saved the taxpayers $10.5 million. Why? Because calls for service went down, the police weren't chasing people around, ticketing people, the people didn't know to go to the emergency room. Just like our little donated, I've told everybody, that little donated refrigerator right there, that costs maybe $100, saves the taxpayers millions and millions of dollars. Why? Because a third of our population here has diabetes. And we all know that you have to refrigerate your insulin. When you're on the street, you can't do that. So what happens? You have seizures. Well, who comes on the seizures? Cops, paramedics, fire. They take the emergency room. Who pays for that? The taxpayers. When this isn't open, the primary care physician for our folks is the emergency room, 100 times the cost of what it is having people here. So you can see the difference in the streets already. We've transitioned over 1,000 people through here. Some people have gone home. Some people have found their own housing. A lot of folks, we just had a guy in here that just got hired about a month ago at Solar Turbines. Found his own job, found his own place to stay, and he's out. So it's a fluid environment where people are actually given an opportunity to get their heads back together, to be safe, to utilize the resources that are here, to start being a human being again, and start their lives over.